Hello, you are watching this video because you are scheduled for a shoulder arthroscopy to treat rotator cuff impingement. You must have many questions regarding the procedure. This video will hopefully answer most, if not all, of your questions. Please follow along with the presentation handouts provided. Should you have any questions after viewing the video, I will be happy to answer them at your next follow-up visit. Let's get started.
The shoulder is composed of the humerus or arm bone, the glenoid or socket, and the scapula or shoulder blade. The shoulder joint is enclosed in a sac called the capsule. The shoulder ligaments are thickening of the capsule. The rotator cuff is a group of 4 muscles going from the scapula to the humeral head or ball. The muscles attach into the humeral head via tendons. The shoulder blade has a bony projection called the acromion, which forms at the top of the shoulder and is above the rotator cuff.
Impingement refers to the pinching of the rotator cuff tendons between the acromion and the humeral head. There is generally a downslope to the edge of the acromion, which projects down onto the tendon when the arm is lifted. Impingement is a spectrum of disease from bursitis to rotator cuff tear. There is also a joint formed by the connection of the clavicle or collarbone and the acromion. It is not uncommon for this joint to become arthritic in association with rotator cuff impingement. It can be an additional source of pain and is addressed at the same time. The natural history is progression unless something is changed by non-operative or surgical treatment. Arthroscopy is an outpatient procedure done through small incisions around the shoulder. Through the small incision, a camera is placed into the shoulder, allowing me to directly see the inside of the shoulder, the cartilage surfaces, the tendons and bones. It is common to shave the undersurface of the acromion during the surgery. This relieves the physical impingement. If the rotator cuff is injured less than 50%, then the tendon can be cleaned up and no further treatment is needed. If the rotator cuff is torn more than 50%, then a repair is performed. Occasionally, unexpected arthritis is found, and unfortunately, this is not treatable via arthroscopy. The biceps tendon, if torn, can be released or reattached to address damage. To address acromioclavicular arthritis, the end of the collarbone is resected. I choose to do this through a small incision instead of arthroscopically. Anesthesia for the surgery consists of general anesthesia with a nerve block. The nerve block will generally last for 18 to 24 hours and is important in postoperative pain management. After rotator cuff repair, you will only be allowed passive motion of the shoulder for 6 weeks. If no rotator cuff repair is performed, then you will start active motion as soon as the block wears off. The block allows you to take pain medication in order to get ahead of the pain before it starts. The night of surgery, I urge patients to take at least some small doses of pain medication to lessen the severity of the pain when the block wears off. Please leave your dressing on for 2 days, then remove it and apply Band-Aids, which can be changed daily. Keep your incision clean and dry for 5 days. After 5 days, it is okay to shower without covering your incisions. After rotator cuff repair, you will wear a sling with a pillow almost all the time, coming out of it only for bathing and physical therapy exercises. Your follow-up appointments will be 10 to 14 days, at 6 weeks, and 12 weeks. After surgery, you will start home health or outpatient therapy as soon as possible, usually within 2 to 3 days. Therapy usually lasts for 8 weeks total. Pain usually spikes when the block wears off and improves over time so that by 5 to 7 days it is manageable without frequent narcotic use. Anti-inflammatories and Tylenol can be used by the 2nd or 3rd day to provide some pain relief. Ice is also a good external pain reliever and anti-inflammatory. As mentioned earlier, without rotator cuff repair, it is okay to move your shoulder actively when the block wears off. Full recovery is expected in 6 weeks. With a rotator cuff repair, it is necessary to avoid active motion for 6 weeks. Passive motion is started as soon as possible and mitigates the stiffness and weakness. Full recovery usually takes 4 to 6 months. Shoulder arthroscopy is very safe. There is a very small chance of complications such as blood vessel or nerve injury, as these structures are not close to where work is being done. The most common problem after shoulder surgery is stiffness. Unfortunately, when the rotator cuff is repaired, the shoulder must not be moved actively for 6 weeks post-op, leading to stiffness and weakness. Therapy is very important to counter this. It is not uncommon for patients to have some residual pain after surgery as well. There are also risks of anesthesia, which will be addressed by your anesthesiologist. In conclusion, rotator cuff disease is a spectrum and commonly referred to as impingement. In the absence of rotator cuff tear, medications to include injections and physical therapy is the mainstay of treatment. If non-operative treatment fails or there is a rotator cuff tear, then surgery is required. Shoulder surgery is painful and takes a long time to improve. Aggressive physical therapy and compliance to instructions are the keys to a good outcome. This is what will give you the best chance to return to the activities that you love.